Hello, this is Dr. Margot Aurae of Aurae M.D. I'd like to go over a little bit about EmbraceRF. So if you're interested in having EmbraceRF and you come in for a consultation and you decide to have it, I want to give you some insight into what to expect prior to coming into your procedure. So if you are going to have an EmbraceRF procedure, you'd want to arrive the day of the procedure with a clean face. So you don't want to have any lotions or ointments or oil on your face. You also don't want to have had any alcohol in the past 48 hours, and definitely no blood thinning medication. So no aspirin for 2 weeks, no ibuprofen or Motrin for 48 hours, and definitely no supplements like omega-3s or green tea or any type of fish oil otherwise that would cause any ginkgo biloba, things that would cause increased bleeding or bruising. So although it is minimally invasive, we are going underneath the skin with a very tiny little probe, and we just don't want to cause any excessive bruising in the neck. Also, if you have any medical conditions like a pacemaker or any metal in the area, or pregnancy or skin cancer or any skin conditions that make you sensitive to heat or eczema or psoriasis in the areas of treatment, this may not be the treatment for you. If you have a history of cold sores, which can often be triggered by heat, then we would just prophylax with a little bit of valcyclovir. So we would have you on that both pre and post procedure for about 5 days, so that wouldn't be a problem. But going through an appropriate preoperative consultation is really important for any procedure, whether it's EmbraceRF or any other thing that really we do in our practice. We want to make sure that you have the best understanding and information in order to prepare properly so that you have the best experience and the best result. So we will walk you through that process and really go through everything to expect. Now, I do use a little bit of medication during this procedure because it's incredibly important to me that my patients have a very good experience. I don't want you to be uncomfortable at all. I really do not believe that you have to suffer to be beautiful, and it's really important that it be tolerable and that you have a really good experience. So you will get a little bit of medication for the procedure, and the procedure is done with local anesthesia. So we numb up topically, and then I inject a little bit of local medication after you're numbed topically, so it's very comfortable, and we go through it very slowly and very gently to keep you just in the utmost care during the entire procedure. So we'll go over all of these things in great detail if you decide to have an EmbraceRF procedure, but I wanted to give you a little bit of an idea what it's like, what to expect. Because we do give a little medication, we do want you to have a ride. Everybody must have a ride and a responsible adult to take care of you once you get home for at least 24 hours. And if you have any further questions, please don't hesitate to call our office. We're always happy to talk to you and answer any questions that you might have. Once again, this is Dr. Margot Aurae at Aurae M.D.